right, good morning. My name is Latoya Wingard, and I will be presenting the impacts of COVID on mental health. Um, I would like to introduce my audience right now. Right here, I have Tiffany Luckett, who is a surgical tech in El Paso, Texas. I also have Montavian Barnes, who works at the local post office. And now that we have introductions out the way, I would like to begin the presentation. All right. So as far as objectives, things we'll be covering within this presentation, we will be going over the impact of technology on mental health during the pandemic. We will also be covering signs that someone may be suffering from poor mental health. And the last objective will be to identify methods to improve mental health during a pandemic. Last year, COVID-19 took over the entire world, literally, and just for anyone that I'm sure all of us are aware, COVID-19 is a highly contagious respiratory virus characterized by flu-like symptoms. It impacted every aspect of life, physical, emotional, financial, and the focus for today will be mental health. Just to give you an idea of the impact, it was the third leading cause of death in the United States last year, coming behind heart disease and cancer. Two of the biggest causes of impact on mental health as a result of COVID came from uncertainty and misinformation. If you were on social media like me, you saw a lot of misinformation. There were a lot of rumors. You saw a lot of people buying up toilet tissue because there was rumors about shortages and things like that. And that is what caused a lot of anxiety in a lot of people. Other causes of impact on mental health included changes in our social norms. We had to adjust to social distancing. We had to adjust to mask mandates. Very intense hand hygiene and hygiene practices, cough and sneeze etiquette. And we also had to, some of us had to adjust to the way we went to school and work, and a lot of us had to do so virtually. The impacts as far as COVID on frontline workers was a little different. Many of us, including me and Tiffany, we had to deal with the fear of contracting the virus at work. We also had to deal with issues related to lack of protective personal equipment. We also had to deal with, we felt a little alienated from, the outside world. If someone knew you worked in healthcare, they probably didn't want to have as much contact with you. Also heightened anxiety in our patient population. They were just as, kind of confused and anxious as we were. So a lot of people came in the hospital more anxious than they normally are. Let's talk about signs of maybe declining mental health as it relates to COVID-19. Some people experience, like we've already stated, increased anxiety, sleep disturbances. Some people, as a result of having to quarantine or have loved ones quarantine, dealt with feelings of loneliness and hopelessness. Other people dealt with new behavioral addictions. Some people turned to gaming and alcoholism or substance abuse. Other people prefer to probably overconsume information. All right, so now we're gonna focus on technology. Technology came and tried to close the gaps in a lot of our things that we had going on in our lives. So it had both negative and positive impacts. Some of the positive impacts included video conferencing, which we're utilizing today. Also, with social media, it spreads information quickly, and if that information is accurate and comes from a credible source, this can be helpful, as it was within the pandemic when we needed to know information, and this was like information being released from like the CDC or your local health department. Some of the negative impacts, just as quickly as accurate information can spread. So can those rumors that we addressed earlier in the presentation. Those type of things can spread, as well as technical difficulties. Everybody wasn't just tech savvy. You had the older population that may not have known how to use maybe an iPhone, so they had to adjust to these things. Also, lack of access. This pertains to our individuals in more rural populations who don't have the same internet access as someone who may stay in a urban area. So this is just a few pictures of how life changed for us. This is a dad with his son. They're both working from home. We have, I think, a grocery delivery which could be done from the phone, which drops off at your door, and we also have someone in a telehealth visit with their physician from home. Some of the treatments of mental health within this pandemic, some form of treatment anyways, going back to consuming credible information and not over consuming information. This is very important because then your mind begins to clutter and you just want to stick to the facts. Participate in physical activity and eat healthy. It's known that if you take care of yourself, you'll feel better about yourself, and this also has an impact on your mood. Communicate with loved ones. Since we have to do so much social distancing, it helps to just keep in contact, even if it's just through a phone or a video call. Journaling and reading mental health blogs. It just makes you feel less alone, and like you have someone out there that can be that supportive role, or someone that can relate to what you're going through. All right. And last for today, I have a quick video I would like for you to watch about how to cope with mental health issues in the pandemic. I think we're almost there. Let's
see. Stress is a state of mind that many of us are experiencing as a result of the new coronavirus pandemic. At this time, it's important that we share how we're coping with this situation. Here are our tips. Some people may feel afraid of falling ill or dying, afraid of losing their livelihoods, of being separated from their loved ones, or being socially excluded. Others may feel frustrated at being unable to protect their families. Some may have lost their jobs, are experiencing economic hardships, and may even be reluctant to visit health facilities out of fear of contracting the virus. In the current situation, it's normal to feel stressed, worried, anxious, sad, confused, frustrated, or even frightened. However, you should strive to remain calm and focus on the things you can do to protect your mental health. There are things that can be done to help relieve stress, to reassure the people you know, and take practical steps to caring for yourself and your family. So what can you do? Talk. When you feel stressed or worried, talking to people that you trust can help. Contact your friends and family. Maintain a healthy lifestyle. If you're isolating or quarantining at home, try to follow a healthy diet. Engage in physical activity, maintain regular sleeping patterns, and stay in touch with your loved ones via email, telephone, or video call. Avoid drinking alcohol, smoking tobacco, or the use of other substances. These will not help to reduce stress. If you feel overwhelmed, talk to a health worker or counselor. Research who you can contact for help in your community if necessary, and keep this information at hand. Seek information from reliable sources. Having up-to-date information on the current situation will help you better evaluate risks and take reasonable precautions. Avoid listening to fabricated rumors and information from unverified sources. For reliable information, consult the PAHO or WHO websites or any other websites provided by health authorities in your country. Limit exposure to news coverage. To minimize your anxiety and unease, limit the time you and your family spend watching or listening to news that you find alarming. Finally, apply previously learned strategies. Try to put into practice skills that you found helpful during difficult situations in the past. For more information, please visit the Pan American Health Organization's website, www.paho.org/coronavirus.
All right, this concludes our presentation for today. I want to thank you guys for taking the time out and being participants in my presentation. If you have any questions, feel free to ask. If not, thank you, and this concludes the presentation.